Last week, we first told you about an unintended consequence from the pandemic. Hospitals are saying they're seeing more people diagnosed with liver disease and in need of a transplant.
Yeah, they say a big factor is how much people started drinking during the pandemic. 90's reporter Anusha Roy joins us this morning. And Anusha, now you've talked to doctors from Health One and UC Health about how they're trying to address this.
Yeah, and unfortunately, Jordan and Corey, both major health systems are seeing something similar. If you just start with the UC Health, they're tracking a record-breaking number of people who need liver transplants, saying more than half of those cases and those severe illnesses are connected back to heavy drinking. You know, right now they're evaluating around 13 patients a week when that used to be as little as 6 to 8 patients a week. And unfortunately, we're hearing the same thing from Health One and tracking that spike in particular since the pandemic. And even more concerning is that doctors are saying their patients are becoming younger and younger. We're talking about people in their 20s and 30s and 40s.
If you look at everybody that gets transplanted, it's probably, I think it's probably 65 to 70% have a degree of an alcoholic component now. And that used to not be it. It used to be hepatitis C and fatty liver. And then you can have an alcoholic component, say with fatty liver or something else too.
No, unfortunately, women are at a higher risk here. UC Health said that a lot of drinks are being marketed for women, but their bodies don't actually process it the same way. So even if when women drink less, they can actually see health problems sooner rather than later because of how much water and fat we have. And ultimately what that boils down to is water can dilute alcohol while fat retains it. And even though they're seeing more patients, the doctors are saying that they're able to keep up with what they're seeing with patients for a couple of reasons. One is the treatment for things like hepatitis C has become so much better. It's actually expanded who can donate their liver, so that's helping out a lot. Also, some of the rules have changed that even people who are actively living with alcohol use disorder, some people are still eligible for a transplant, even though that wasn't the case before. So Corey and Jordan, doctors are really urging people, ask questions, don't be hindered by what you may have heard in the past, and know that there's a lot of people out there who are looking to help.
Yeah, incredible advancement in medical technology for sure. Anusha, thank you.